I'm Nancy Brown, CEO of the American Heart Association, and I am so honored to be joined by Dr. Gary Gibbons, Director of the National Heart, Lung, and Blood Institute, and a longtime member and volunteer for the American Heart Association, and a dear, dear friend. It's really exciting that this year the NHLBI is celebrating 75 years supporting groundbreaking research that has helped to improve longevity and the quality of life for patients nationwide and around the world. I've really been looking forward to this discussion because it is maybe ironic or maybe serendipity that in the same year the NHLBI is celebrating a huge milestone, 75 years of impact. The American Heart Association is also celebrating a milestone, 100 years of impact. I'd love to ask you what you think of as the most prideful moments in the Institute's progress over the past 75 years.
First, I think we have to, from the NHLBI standpoint, celebrating our 75th anniversary, give homage and gratitude to the American Heart Association. You were, as the progenitor in raising the flag about research in heart disease. And so it's really the AHA being a forerunner and a catalyst for change in heart disease that was part of the inception of the National Heart Institute that's now the NHLBI. And so we appreciate that initial effort that made this institute possible. And during that same inception was the Framingham Heart Study, which is also celebrating its 75th anniversary as really the iconic study that really started to characterize the risk factors for heart disease that really set the stage for what has been, I think, almost a poster child of how research can be translated into public health impact. It's because of the Framingham recognizing smoking, diabetes, high blood pressure were all critical factors, played a role in setting the stage for the 71% decrease in coronary heart disease that occurred over a 50-year period, in much part related to the research and what we learned about those drivers, as well as interventions, both public health interventions in terms of smoking cessation and reducing the use of tobacco in our country, as well as groundbreaking innovations and the discovery of the pathways that create cholesterol and promote its risk, as well as the development of drugs to lower that, demonstrated in clinical trials. So when you reflect on those activities, it really comes down to maybe three core elements. Certainly our iconic cohort observational studies like Framingham, that we've built out the portfolio to be more diverse and reflective of America, such that we have the studies of Latinos, Jackson Heart Study, the largest African-American cohort study for cardiovascular disease, the Strong Heart Study focusing on American Indians, as well as our new studies, Rural, which is really now looking at where the communities that have not benefited the most from those advances, often those rural communities, communities of color, where is now a major part of our priority. So in many ways, our two institutions related and committed to enhancing heart health have collaborated marvelously over 75 and 100 years of our existence.
It's really amazing when you think about it, and how things like risk factor management impacts so many people in this country. So many of the large studies that have been funded by the federal government through the NHLBI. And the cohort studies, as you mentioned, have really given, great knowledge. And what do you think about for the future? What's in store for the NHLBI for the next 75 years?
Well, we're always optimistic, and we'd like to have a bold vision that I know we share with you, that we're hopeful that we'll refine the ability both to predict, but more importantly, Nancy, to prevent and indeed maybe preempt heart disease, such that it's no longer a chronic disease of the elderly that we just try to slow the progression, but that in fact we can more precisely intervene much earlier in the disease process in a way that will change the whole trajectory of heart disease. That's our vision, and I think it's one we share with you, where we can get into precision health and precision medicine, leveraging the new tools and technologies of genetics and genomics, where we can actually predict someone's lifetime risk. And we don't have to wait till they're 55 or 60 to start to do something about it. And so I think as we get a deeper understanding of those factors at the molecular level and recognize new targets, working in the ecosystem with our colleagues in the private sector and pharma and biotech, now leveraging the new tools of artificial intelligence and machine learning to be even more precise about the prediction, leveraging new tools such as mobile and personal sensor technology. We believe that we're in a transformative age to prevent and preempt heart disease.
It really is exciting to think what's ahead and how all of this innovation can really save people's lives. Gary, I know another thing the American Heart Association and the NHLBI share in common, and you've mentioned it a couple of times already, is our deep commitment to and concern for persons who may not have the same advantage when it comes to clinical care and outcomes of research. Is there anything in particular you might like to highlight about the work NHLBI is doing today?
Well, again, this is where our histories intertwine and of shared interests, shared values, that we know that not all communities have benefited from the rich abundance of our research. And it's really important that that research and discovery science reaches all communities, such that all communities are thriving with healthy hearts. I know you share that same vision, and you've done extraordinary work in addressing health equity and eliminating health disparities. Our data suggests is those communities, particularly those in rural America, and some of the more socially deprived communities of color, have actually had rates going up in heart disease, indeed promoted by the obesity and diabetes expansion that have occurred. And so I think that's our next challenge, to how we focus in on those populations at risk and really think about how we can enhance both their inclusion in research, but also ensure that those benefits are practice changing and in ways that affects those communities as well. And again, we look forward to our collaborative partnership in that space.
Working together, we can be so much stronger. And I think we demonstrate that over and over and over again. You know, an area of inequity was highlighted recently at an event that you and I both had the honor of attending, and that was a reception hosted by President Biden and the First Lady to really highlight the fact that women's health and women's research has been underfunded. And of course, this has been a main priority of the American Heart Association's advocacy and our Go Red for Women campaign. And I know a deep passion for you and all of the Institute directors, Gary. There was an executive order signed by the president at this reception. How do you look at this as an Institute director, and what opportunities do you hope that this will bring forward?
As you know, this is an area of shared passion. And indeed, as you're aware, one of the elements of, quite frankly, the Framingham's heart study 75 years ago, long before it was politically correct, included women as 50% of the first Framingham heart study cohort. And so it was that study that showed that the onset of the increased risk of cardiovascular disease in women was delayed for about 10 to 12 years, relatively speaking, corresponding to the shift in menopause phase. And so that was an early observation of really sex-specific differences in cardiovascular disease. In research, we've gone on to document different ways in how heart disease presents clinically in women compared to men, and in different elements of the pathobiology of heart disease in women. So this is an important element of our research agenda. As you also know, we are the home of the Women's Health Initiative cohort that, again, has provided a wealth of information about sex-specific differences in cardiovascular disease. So we're looking forward to, with this new initiative, to further, again, enhancing it. And you might argue, Nancy, that in some ways, recognizing sex as a biological variable is almost the essence of precision health and precision medicine. And so we still, I think, have an opportunity to really learn what is it about that transition for women as they go through menopause that shifts the balance and it modifies their risk of cardiovascular disease. I'm hopeful that that'll give us new clues as to how we can more effectively enhance the lives of women specifically. We're very excited about the potential opportunity to leverage our precision medicine initiative called TopMed, hopefully in partnership with you at the AHA, to further understand what are the molecular drivers that are part of that shift premenopause to menopause that shifts that risk as a means of better addressing the needs of women in midlife. Similarly, we're hopeful that we'll continue that same sort of effort of the systems biology of women's health related to women of reproductive age, recognizing that often pregnancy is itself a stress test that starts to give us the harbingers of risk for later heart disease amongst pregnant women, and also insights as to how we can reduce maternal morbidity and mortality. So we think that there are some incredible opportunities we're excited to pursue as part of a Women's Health Research Initiative anew.
It is an exciting moment, and so much potential on the landscape to save and improve lives in this country. Dr. Gary Gibbons, thank you for being here with me today. Thank you for being a stalwart leader of science and research in this country for several decades. You have been at the front of the arrow of some of the most important decisions that have impacted people in their everyday lives. And I consider you an American hero. So thank you for all that you do, Dr. Gibbons. And thank you for the partnership between NHLBI and the American Heart Association. It is one that we treasure. Happy anniversary.